Do you find yourself having anxiety, including having more fear and dread than usual? You can overreact when something triggers your emotions, or you can't control your responses to situations. Anxiety disorders can make it difficult to get through the day. That's why Xanax is the #1 drug for anxiety.
Hello. Hi. Alprazolam. It's more commonly known as Xanax, and it's an anxiolytic under the classification of benzodiazepines. Used to help with anxiety disorder, panic disorder, and anxiety associated with depression. Here you go.
Thank you.
Xanax acts on the central nervous system to produce a calming effect by enhancing the effects of a certain natural chemical in the body called GABA. GABA is a natural chemical that's a neurotransmitter which relieves anxiety symptoms. When taking this medication, some things to expect that could happen called adverse reactions is depression, hallucinations, confusion, agitation, bizarre behavior, drowsiness, a headache, tremors, increased risk of falls, rash and itching, photosensitivity, and GI effects such as vomiting, diarrhea, and nausea. Do not take this medication if you feel you are mentally depressed, suicidal tendencies, history of substance abuse, depressed vital signs, pulmonary disease, respiratory depression, if you're pregnant and lactation, in children, and if your liver and kidney are dysfunctioning. Be careful when operating machinery, such as driving in any automobile, due to the adverse reaction of drowsiness and hallucinations and confusion. Interactions with this drug consist of central nervous system depressants, which are analgesics, sedative hypnotics, and muscle relaxants, and alcohol. These could potentially overdose with this drug when they're mixed together. Oral contraceptives and calcium channel blockers all reduce the elimination of these drugs, leading to increased and excessive sedation or impaired psychomotor function. When taking this drug, you don't want to take with grapefruit juice because it can pronotate the effects of orally administered drugs. Some things to know when taking this drug is Xanax is most abused because of its quick onset, which leads to euphoria. So be careful with the potential of abuse. Sudden withdrawal after prolonged use may result in seizures, agitation, insomnia, and gastric distress. When administering higher doses, make sure you take them at bedtime to avoid daytime sedation. Watch for hypoxia and cardiac arrest. Watch your respiratory status, and it should be monitored continuously. And patients with electrolyte imbalance, renal impairment, and congestive heart failure in children are at increased risk of complications. Do you have any questions?
Nursing diagnosis. Anxiety related to sudden triggers causing stress, worry, and agitation as evidenced by becoming stressed due to an unfamiliar situation or place. Nausea related to anxiety and fear as evidenced by patient feeling like they're going to vomit and patient looking green and sweating.